Short stature, quite an interesting topic. This is with a lot of pictures and images and clinical stuff. So short stature is defined as what? Short stature in simple words is defined as height less than third percentile. This is now, one second, yeah, this is now a very interesting point. If you can look at the image, the third child, the right side, she's having short stature. Photographic memory plays a very strong role. Imagine this is a photo and this patient comes to you that my doctor, my child is not gaining height. Okay. For example, she's a 4-year child, 4-year-old child, for example. So first of all, if I ask you a very random question that what is the, what you called, yes, what is the expected height of a 4-year-old? Okay. Yes, the expected height of a 4-year-old is 100 centimeter. Okay, I'll repeat again. If I ask you a very simple question, what is the height of a 4-year-old? Remember, the height of a 4-year-old is 100 centimeter. So if this patient short stature is defined as height less than third percentile or less than -2 standard deviation. Like you open the book, in the book you have some charts where we follow normal centile, then -1, -2, -3. So if the height of a patient according to the age and sex is less than third percentile or less than -2 standard deviation, that is known as short stature. This was my NEET SS question. I gave the exam of for DM. This was the question. How do you define short stature? And something which goes same like standard deviation, micro and macrocephaly also. Microcephaly is head circumference less than -3 standard deviation, and macrocephaly is head circumference more than 2 standard deviation. Remember, micro and macro is -3 and +2, whereas short stature is height less than -2 standard deviation. Upper segment to lower segment ratio. So the normal upper segment to lower segment ratio is 1.7:1. At 3 year of life, it is 1.3:1. And at 7 year onwards, it becomes 1:1. So this is a MCQ. They ask in exam, what is the normal upper segment, lower segment ratio at 7 year of life? The answer is 1:1. Okay, number one. Number two, yeah, now see this examples. This is short stature. If you would have seen Game of Thrones, you have the Tyrion Lannister, and he's having this short stature. Now, short stature, I told you. So we have, okay, see, so we have physiological and pathological short stature. And in pathological short stature, or pathology means problem, because of some anemia, malnutrition, some problem, that short stature is divided into proportionate and disproportionate short stature. What is proportionate short stature? Proportionate short stature, as the name says, proportionately short stature. Like how much ever the upper segment is short, that much only lower segment is short. So both are short, so the ratio becomes normal. The ratio becomes normal in a case of proportionate short stature because the upper segment and lower segment both are short. Whereas disproportionate, as the name says, disproportionate, तो या तो अपर सेगमेंट इफेक्ट होगा या लोअर सेगमेंट इफेक्ट होगा. अगर अपर सेगमेंट छोटा हो रहा है तो उसको क्या बोलेंगे? शॉर्ट ट्रंक dwarfism. And if the lower segment is getting affected, that will be known as short limb dwarfism. So I'll repeat again. Short stature is divided into physiological and pathological, and pathological is divided into disproportionate and disproportionate, and disproportionate is divided into short trunk dwarfism and short limb dwarfism. Now, yes. Now, what are the causes of proportionate short stature? Like जितना upper segment छोटा हुआ है, उतना ही lower segment छोटा हुआ है. Proportionate short stature. The causes are, so there are, yeah, exactly 3 C's are there: constitutional short stature, chronic infection, and congenital hearts. Both हमने करा ही हुआ है. So the mnemonic is 3 centimeter. 3 centimeter are the causes of proportionately short stature. C for constitutional delay in growth and puberty, CDGP, or you can say constitutional cause. Second C, chronic infections, and third C is congenital heart disease. It is 3 centimeter, meter for malabsorptions. So that's what. Okay. Okay, let's go to the next slide. Hmm. So let's have a very quick revision of what we have spoken. So in this class, we got an idea that short stature is defined as height less than third percentile or less than -2 standard deviation. Tall stature will be height more than 2 standard deviation. For that, the mnemonic was match, Marfan syndrome, acromegaly, cerebral gigantism, T for क्या था? हाँ, chromosomal problem like Klinefelter, and H for homocystinuria. We have proportionate and disproportionate physiological and pathological short stature. In physiological, mom and dad are short, baby will be short. And in pathological, it is divided into like any chronic problems basically. C is the mnemonic: constipation, chronic problems, cerebral palsy, congenital heart, cystic fibrosis. All these basically indirectly will affect my height, and that will cause short stature. And malabsorptions, celiac disease, chronic liver disease. Yeah, all these causes are there. Down syndrome, Turner syndrome. And I told you, to calculate or to evaluate for short stature, you need to calculate the upper segment, lower segment ratio. Because there are some specific disease, the ratio increases. There are some specific disease, the ratio decreases. And there are specific disease, the ratio is normal. Like how much ever the upper segment is short, that much only the lower segment is short.